Today the topic is about Omicron. A lot of people are asking me to talk about the Omicron. It is a variant of the coronavirus. Why the name of Omicron has come is in the Greek language they use alphabets. It is a Greek alphabet O, and O there is a two variants, Omega and O micro. So micro means small. So Omicron is in the O, it is a small part that is called as Omicron. So the changes happen most of the time in the spike protein. These are the, as you can see, the coronavirus has a outer shell that there is a spike which is attaches to the human body. So why should a virus mutate? That is most of the time people are asking me what is mutation and why it should mutate. This is the hook. Yes, protein is a hook by which it attaches to the human body. So whenever it want to attach to the human body, actually our antibodies also will try to fight against it and avoid the infection. So the virus has to try to convert itself and develop a newer model by which it is able to attach to the human body. So this changes can happen at most of the time at the protein level is called as spike protein. So in addition to the spike protein, we also have as you can see, there is an envelope, there is a nuclear protein, and there is spike protein, and there is a membrane protein. So these are all nothing but what is meant by protein, nothing but a nucleic material that is developed from the RNA virus. RNA virus are always have a very high chances of going for mutation. Why they have to change is they have to show a change so that they can get infected easily. They can infect the human being. It is a fight between the virus and the human body. The virus is trying to infect as many people as in as much short of time, and the human body wants to try to fight against it. In this, what happens is the S protein is the main hook of the coronavirus. So the changes happen at the S protein. What are the changes that we are talking about is these are called as genomic studies. By doing a gene sequence, they can able to make out how the virus is changing. This gene sequence, there are changes in the nuclear matrix. Our most important is RBD, receptor based domain. Domain is nothing but a protein. At this level of Y505H is a common changes that is seen in all the variants. What are the variants that are there? Alpha, beta, gamma and delta. As you have seen, delta variant has caused a lot of infection because it is a little bit different from other variants. Is instead of attaching to the RBD, it also has a strong affinity to the ACE receptor. Because of that, the death rate has been very high. So by bringing these changes, what happens is the Omicron is 13 times more infective and 2.8 times more infectious than the Delta variant. Because of that, it has become now all the patients that we are seeing recently, the last 20-30 days are Omicron variant. So a lot of people are confusing, is it a new virus? It is not a new virus. It is nothing but a change that is happening in the coronavirus. Basic virus is same. So only the change is in the small protein. Because just a virus has brought some change, it is like somebody going for a beauty parlor or somebody going for a plastic surgery, bring some changes in the nose or ear or in the eye. Doesn't mean it's a new person. In the same way, Omicron has brought some changes. It is nothing but still coronavirus. So again, the symptom science and the pathology, pathophysiology, management are same. It's nothing different. And moreover, in the last 28 days that we are seeing, the death rate is a little bit low, but the very high infectivity is there. So another big important point that I want to tell is because the spike protein has a lot of disruption, because it goes on number of changes that are happening. What happens is when you do a RT-PCR cell test, the S gene will be made out that will be failing. So that is called a targeted failure. This is used in the RT-PCR to make Omicron. This is used in the nowadays called as Tata Sure or Omisure test, which is available. So what is the significance of Omicron is, second significance is it is mostly doesn't work. A lot of the cocktail antibodies do not work against it. The two commonly used one are not used. Still now region CO2 and 135 are found to be still effective. Next is why the virus will they affect or not. What next? Still we can have the Omicron has a our own vaccines are still effective, so we need not panic. The vaccines which we have taken are still effective against the Omicron virus, and we need not go for any extra dose or anything. What is how the next we have to plan is, we have to go for not going for third, fourth, fifth vaccine, but we have to see that what are few 44 crores people are not yet taken the vaccine. See that the entire globe takes the vaccine. We have to give a vaccine diplomacy and reach the lot of poor countries are there in Africa and South America and Asian countries. By using our manufacturing R&D, and because we are able to give 100 crore vaccines and 150 crore vaccination till day, we should be able to help the other countries. And India is in a very good strong position globally to see that we can come to bring an end to the coronavirus by two methods. One is the pharmacological method vaccine, second is non-pharmacological method, test, trace, track and treat. By this simple method, I want to advise all the people to come forward and help the government and help the doctors and help the medical fraternity, so that when the people participate only, this virus can come to an end. Thank you.